All right, so the next thing we're going to talk about is multi-fetal pregnancy. So we talked about conception in the context of one ovum released, that ovum fertilized, that cell division results in one fetus. So how do we get twins, triplets, and higher order multiples? Let's start with twins, and then we'll talk a little bit about how that applies to higher order multiples. So we can have dizygotic twins. That's also another term for that is fraternal twins. Most of you probably know some fraternal twins. This is when two mature ova are released and fertilized. Both zygotes implant. They have separate membranes and placentas. Now, sometimes if the placentas are near each other in the uterine wall, they will fuse, but they begin separately. Dizygotic twins are no more genetically similar than any other siblings. So what happens with dizygotic twins or fraternal twins, two ova are released at the same time or in the same cycle and fertilized in the same cycle. This is more common in women of African descent, less common in women of Asian descent. It is also more common as women age, maternal age advances, have more babies, so with increased parity and with the use of fertility drugs. Okay, so that's dizygotic twins. So how do identical twins happen? Identical twins or monozygotic twins happen when a single ovum is fertilized and that zygote divides completely into two separate zygotes. And then those zygotes separate and begin to divide. If that happens very soon after fertilization, then there will be separate membranes and separate placenta. Okay, so we have sperm, ovum, one zygote divides completely into two zygotes right away. Each is going to have their own membranes and placenta. If it happens between 4 and 8 days, then you're going to have two embryos, two amnions, because each embryo is going to form its own amnion, but they'll share a chorion and a placenta. And so what do you think can happen if two embryos are sharing the same placenta? One of them may actually be getting better perfusion than the other. If it's after day 8, the two embryos will share membranes and placentas. So now we have two embryos within one bag. So if we've got one bag of waters with two fetuses, there's a greater risk of entanglement and cord accidents. If the division is very late, then the division may not be complete and we may have conjoined twins. Now, higher order multiples, triplets, quadruplets, etc., actually can result from varying combinations of those. So we can have triplets that are 3 separate zygotes, all implant separately. We can have 2 separate zygotes. One of them divides completely, so now we've got triplets, and 2 of those are identical. There actually have been a couple of cases, it's very rare, in which a zygote divides into 2 and then divides into 2 again, and we have identical quadruplets that have occurred naturally. There was an adorable set of identical quads that was on commercials a while back that were super cute, but that's a really rare occurrence. So anytime we can have any combination of those. So we know that higher order multiples are more rare. They're more common now because of fertility treatments. Most fertility treatments promote increased ovulation, or if we're talking about assisted reproductive technology, they may involve the transfer of multiple zygotes or embryos. So that's where we end up with higher order multiples. Usually in nature, higher order multiples are fairly rare. Okay, we're going to come back in the next video and talk about factors that affect development.